Hello everyone, this topic is about the blood supply of the heart. So, you know that from the left ventricle, the ascending aorta arises and it gives two branches. One is the left coronary, the other one is right coronary. So, let's start with the left coronary branch. Left coronary artery arises from the left posterior aortic sinus of the ascending aorta. So it has a very short trunk. As you can see in this picture, you can see that the left coronary has a very short trunk. To make it very easy, I have mentioned only the important branches. So this left coronary divides into mainly two branches: anterior interventricular artery and left circumflex artery. Okay, so this left circumflex branch, sometimes in 10% of the people, it can also merge with the posterior interventricular artery, which is a branch from the right coronary artery. So it can anastomose with that one. So this is the left coronary artery branches. So there is one here, another one here. So what do you mean by circumflex? Circumflex means something that goes round. So if you lift this left auricle, you'll be able to notice the circumflex branch. And where is this left coronary coming from? It is coming behind this pulmonary trunk. Okay, so you should notice this. The one which is coming behind this pulmonary trunk is the main trunk, and then it is dividing into two branches. Anterior interventricular artery, here this one, it runs in the groove, that is anterior interventricular groove, and it gives many branches. So the important branches are the anterior interventricular ventricular branches, then some diagonal artery, conus artery, septal branches, many of these branches which supply both these ventricles, and also it supplies the apex of the heart. So this is about this branch, that is anterior interventricular artery, which runs in this groove, that is anterior interventricular groove. Now coming to the other branch, that is the left circumflex artery. Here you can see that it is running in a horizontal direction, that supplies the left atrium and also the left side ventricle. Okay, so the left ventricle has supply from both of them. That's what it means. So now coming to the next one, that is the right coronary artery. So here we have the right coronary artery. It also gives two branches, and it arises from the anterior aortic sinus, and it gives many branches. Similarly, like it also gives conus artery. Then it gives many of the interventricular branches all on the right side, and there is one important branch, that is right marginal artery. So that you have to notice. The marginal artery is this one. This one. That is the right marginal artery. So now here I told about the two branches. One is the posterior interventricular artery. The other one is right marginal. So there is right marginal and posterior interventricular branch. This is the one. So you can see that is the posterior interventricular branch and the marginal branch. So these two are the main branches from the right coronary artery. So this one is coming from the anterior aortic sinus of ascending aorta. So this is the ascending aorta. So you can see one here, the other one is here. So this is about the blood supply of the heart, which you can see here. So what does this one supply? The left coronary, two branches, they supply apex, both ventricles. Circumflex supplies the left atrium and the left ventricle, and the right coronary has two branches, that is posterior interventricular artery and right marginal. This one supplies posterior side of both the ventricles, and also the right marginal supply is the right ventricle. So this is about the blood supply of the